welcome to another episode of Caring for You with me, Dr. Terence Drew. And today we're going to speak about peptic ulcer disease, which is really a sore in the gastrointestinal system, specifically the stomach and the small intestine, the area that we call the duodenum, which are the most common areas. So, what are the risk factors for developing an ulcer? Most importantly is having a bacteria that is called H. pylori. H. pylori occupies the small intestines and can affect the lining of the gastrointestinal tract, the stomach, and the duodenum, and cause a sore to develop. But other common risk factors are smoking, excessive alcohol, taking certain medications such as NSAIDs, these are ibuprofen, Motrin, Advil, those types, even aspirin can result in that. What about steroids such as prednisone, for which people take for asthma and other diseases such as lupus, which we spoke about sometime earlier. And some people have implicated certain types of food that are very high in acid content and so forth, but those are the most important ones in the general way that can predispose you to developing a peptic ulcer. Now, what are the symptoms? The symptoms are pain in the stomach area, and that pain can be whether it is when you eat. For example, with gastric ulcers, they worsen when you eat, and the duodenum ulcers, they worsen when your stomach is empty. So the patient will come and say to you, at 2-3 o'clock in the morning, I'm waking up with a pain in my belly, abdominal pain. And that would help the doctor to think that this can really be a duodenal ulcer. So apart from pain, people can have vomiting. They can have even bleeding where they vomit blood, or can have very dark stool. And that stool, which we call melena, is where the blood leaks, comes from the stomach or duodenum, the small intestine, and it goes through the tract and is digested and comes in the stool as being very dark. So people can say, I have black stools. You can feel weak, tired as a result of the blood loss. Some people have what you call early satiety. That means they become full very early. And so these are the most common ones: the abdominal pain, the appetite being affected, nausea, vomiting, the black stool, black vomiting. And so you will go to the doctor. The doctor would listen to your symptomology. And how would he diagnose you? He can send you for what is called an upper endoscopy, where they pass a camera with a tube down into the stomach and small intestine and visualize the ulcer. The other thing that can be done is something we call a barium meal, where you swallow a white milkshake looking substance, and then x-rays are done to reveal what we call indirect signs of the ulcer, to show the ulcer up. Additionally, blood tests can be drawn where you look for antibodies for the H. pylori, that bacteria that we spoke about, or you can do what is called a stool antigen test, where we look in the stool and look for the same bacteria that we call H. pylori. And there's another one called a breath test that we don't do here in St. Kitts and Nevis, by breathing into a special type of equipment that can signal whether or not you have H. pylori in your system. And once H. pylori is present, you have to get rid of it, and that is typically treated with up to 2 weeks of antibiotics. And getting rid of the H. pylori can really help to heal the ulcer and prevent it. So once you are diagnosed, how is it treated? I just started mainly by antibiotics. In the old days, there used to be a lot of surgeries. They had surgeons who were specialists in peptic ulcer disease. But when it was discovered that H. pylori, that bacteria, was the #1 cause of peptic ulcer disease, antibiotic treatment of that bacteria healed a lot of ulcers. And so people now don't have to undergo surgical procedures as a result. But you have to do other things, such as watching your diet, eliminate the smoking, the alcohol intake. I encourage people to eat on time, avoid medication like ibuprofen, aspirin, and NSAIDs unless absolutely necessary, and these can help. Some people ask about milk. In the old days, milk used to be part of the treatment for peptic ulcer disease. But it has been shown now that milk actually increases the acid content in the stomach, and so it is not encouraged as before. We have other types of treatments such as Dica, which is very common, which is a liquid that you drink, which helps to neutralize the acid. Some people will take Tums, Alka-Seltzer, Eno, Andrews, and many different types of acids. But the mainstay of acid treatment is what we call the PPIs, or the proton pump inhibitors, such as Prilosec, omeprazole, pantoprazole, Nexium, esomeprazole. You can also take Zantac, but recently there has been some discussion about Zantac, and it will, so I'm suspecting it will be removed from the market at some point. So I wouldn't have Zantac high up on the list. You can also take Pepto-Bismol, which is popularly known to cause darkness of the stool. If you do, is that pink liquid. So these are the mainstay, but I still encourage people to always practice good lifestyle and ensure that you protect your gastrointestinal health or protect yourself from getting peptic ulcer disease. And so I want to thank you for joining me on another episode of Caring for You with me, Dr. Terence Drew.